Hey, Dr. Robert Inesta here from Westchester Sports and Wellness. Before treating a patient with lower back pain, it's very important to determine the pain generator, right? Which tissues are actually creating the pain? Is it a disc that's herniated or bulged or maybe even deranged? Is it muscle pain? Is it connective tissue pain? Is it joint pain from the sacroiliac joint or the spinal joints? Is it a combination of all of the above, which very often is the case? Next, we need to determine the mechanical cause. Okay, is it something coming from above or below the lumbar spine? Is it hip dysfunction? So the hip, if it's not moving properly, can often cause stress in the lower back and also below in the knee. One of the most common patterns that I see with lower back pain is that the hip is heavily involved. Okay, the hip is not rotating properly or extending properly, and then again, it's transferring that stress to the areas above, which is the lower back, creating excess stress on those tissues, which will eventually cause a problem. So again, really getting to the bottom of the problem mechanically. Then looking at the patient's lifestyle. What is happening in their lifestyle that's creating this situation in the first place? Are they doing something on a repetitive basis that's causing harm? Are they sitting with poor posture? Are they bending and lifting inappropriately? Are they leaning a certain way or doing a certain exercise that's not appropriate for them? So really determining, again, the causative factor in the lifestyle, to me, is the most important part of the treatment. Because if we make those changes and modifications, then the results will be long lasting, right? If we actually correct the source of the problem, we don't just want temporary relief, we want long lasting results. Now, as far as what we do here with passive treatments, we'll use a combination of acupuncture to regulate the nervous system and release deep tension in the connective tissues and muscles. We will use soft tissue techniques such as Stecco Fascial Manipulation and active release techniques, which are amazing for releasing tension in the fascia and muscles. All right, these are incredible techniques, very, very effective, especially in combination with the other modalities that we use. Like I was saying earlier, if the hip is restricted, we need to restore normal movement in the hip in order to decrease the strain on the lumbar spine. That's just an example. There are many other scenarios, of course. So soft tissue manipulation, then joint manipulation as well, chiropractic manipulation to mobilize the joints of the vertebrae. All right, that's very helpful because many times these vertebrae will become fixated or restricted. And again, normalizing the movements of the joints will help to regulate the nervous system. It will help to reduce tension in the soft tissues as well, and just better restore balance in the whole functional unit. Also mobilizing the hips, right? Doing manipulation in the hips or the sacroiliac joint, very, very important, very effective when appropriate. Then we will encourage an exercise program to stabilize the core, but a healthy exercise program. We don't want to do things that are going to harm the spine, which is what many exercise programs do. We want to do things that are going to spare or protect the spine. So that's, again, very, very important. And we'll look at nutritional interventions as well, encouraging an anti-inflammatory lifestyle and possibly supplementation to help resolve inflammation and better or optimize function of the nervous system, of the connective tissues, basically all these systems, okay, together. So this is the approach that we use. Again, every individual is different. A thorough evaluation to determine the needs of the patient and then designing a specific program for that individual. I hope you found this informative and useful. If you did, if you know anybody who may benefit from this information, please feel free to share this. If you have any questions or feel you may benefit from the services that we provide, certainly reach out. Feel free to contact us, info@westchestersportsandwellness.com, or give us a call, 914-771-9355. Also check out the website, westchestersportsandwellness.com. Has a lot of great information there on the techniques that we provide and the conditions that we treat. Thanks so much for watching.